China grappling with a rising death toll and new cases of the Wuhan coronavirus. 170 deaths and more than 7,700 infections. The virus has spread to every region in China. And across the region, countries are dealing with citizens infected at ground zero. Evacuation plans are being fast-tracked. The World Health Organization set to meet tonight in Geneva as it considers a global response. The emergency committee consists of a panel of 16 independent experts. Now, a closer look at how the WHO can help in this crisis. And we're joined by Dr. Danielle Anderson. She is the Assistant Professor for Emerging Infectious Diseases at the Duke-NUS Medical School. Danielle, welcome. Remind us once again, what exactly is the role of the World Health Organizations in situations like this?
So since the outbreak of SARS, it really was a wake-up call for the world to be prepared in times of epidemics and pandemics. So what the World Health Organization can do at the international level is quickly share information about health threats and coordinate responsiveness. So that's what their meeting is about tonight, and to declare to the international community how dangerous these threats actually are.
Dr. Anderson, the rapid spread of the disease in China, how concerned are you about the rising numbers that we're seeing here?
So the numbers are concerning, especially because it escalated so quickly, and it seems from the outside that it's increasing at an exponential rate, but and we aren't sure what those numbers will end up at. But hopefully with the quarantine measures in place and wider recognition of what's happening in Wuhan, it can be controlled.
Now, from what you've heard so far, in terms of the source of the virus, are we any closer to identifying what that is, whether it's a bat or some other animal?
So with SARS, we know that the infection originated in bats, and then that was spread to civet cats. So it's likely from the word that's coming out of China that through the market, which was a seafood market, although there were other animals present, it's possible that this is a bat virus, and then it could have either been spread directly to people or to other animals, and then people via those other animals. But we don't have the full information about if the animals have been tested and if they're positive or negative. So without the actual information out of China, it's difficult to say at the moment.
And on the issue of animals, is there any reason that pet owners perhaps should worry about their pets? I mean, is there a possibility for this coronavirus to be transmitted to them?
So lots of animals can be infected with coronavirus, and this has been different coronaviruses. So each animal generally have their own sort of coronaviruses. So there's dog coronaviruses, and cats can be infected, and actually they can get a disease called feline infectious peritonitis, which is fatal in about 10% of the cases. But this particular virus, again, we don't have information of any sort of transmission from humans back to those pets. So I would say it's unlikely, but again, no information at the moment.
Just a point, because you told us a bit about the domestic animals, at least when it comes to that. But what about pets that are wild, outdoors even? Do we have to perhaps be a bit more guarded when we go outdoors and come across animals?
So there are wild animals can be infected with their own coronavirus, such as horses or cows, and of course bats and different wild animals that you can come across with. But not only for coronaviruses, but other viruses in general, if they're wild animals, you should take precautions to try to not come in contact with them, because you don't know what sort of viruses or bacteria that they could be holding.
All right, we've been speaking with Dr. Danielle Anderson, Assistant Professor at Duke-NUS Medical School there.